One of the common concerns that I get from parents is my child doesn't eat. They don't eat enough, they hardly eat anything. This is different from the picky eaters, and that's another video that you should watch. But those kids who just don't seem to have much of an appetite. And the first thing that I really do when I hear that is to take a look at the child's growth charts. This is why we do growth charts in a pediatric office and why they're so important. So we can follow and see how well the child is tracking on their growth charts. Even if they're towards the bottom of those curves, if they're following their weight curves appropriately, they're getting the nutrition that they need to grow. And so whether or not it seems like they have a good appetite may not be important. But what is important is that they're growing appropriately, following those growth curves. Now, if they're not following those growth curves, then we need to do some more looking. Is it a behavioral issue? Is it a nutritional issue? Is it a medical condition that could be causing the problem? So we have to do some looking into those things, and that's where you need to work with your child's healthcare professional. If the child is following their growth curves appropriately, they're getting all the nutrition that they need to grow, and that's the most important thing. You can always work with your child to develop better nutritional habits, to get more of those fruits and vegetables, to get more variety in what they eat. And to do that, I recommend that parents be patient and be persistent. Continue to offer a wide variety of foods for your child. That's the best way to get them to eat a better variety and lots of different things. If mealtime becomes a fight, there's no winner. If you push your child to eat more, and you force them to eat, make them eat, then you're almost guaranteed to have the opposite effect from what you want. It's always a good idea to get your child involved in the eating and food preparation process, to get them more interested in what's going on in the kitchen and really have them be involved in the nutritional choices that they're making. I love having kids do some gardening because that gets them involved right from the seed to the fruit or vegetable. It's easy for us as adults to look at a child's eating habits and think they're not eating enough. They simply don't need as much food as an adult is. A portion size for a child may be only fractions of what a portion size is for an adult. For example, for fruits and vegetables and meats, a serving size for a child is probably about the size of the palm of their hand. That may not seem like much to an adult, but for a child, that's all they need to grow. And many kids go through growth spurts. Many parents are familiar with this. The appetite will go up and down depending on how they're growing. And that is normal eating behavior for kids. Many cultures and families show love by providing food. Reciprocating that love involves eating all of that food. And that can get kids into overeating. Parents always need to set a good example for their kids. Make eating fun, make mealtime family time, and make it fun time. Don't make it a chore filled with rules and consequences. They will eat what they need, generally speaking, in the absence of other medical conditions. So some kids with medical conditions, including kids with autism, may have sensory issues, and that makes it hard for them to eat the foods that they need to eat. If a child is not growing appropriately, not following those growth charts, then your pediatrician may recommend some particular things to do. There may be behavioral, there may be therapy involved. For kids with ADHD, they are oftentimes too busy, too active to stop and eat. And particularly some of the medications that we use to treat ADHD can reduce appetite in kids. So sometimes you have to feed them creatively at times when their medication is not in effect. If you have any concerns about your child's appetite or your child's ability to eat the food that they need to grow, please talk to your child's healthcare provider and take a look at the child's growth curves with your child's healthcare provider to help determine if there's a problem, and if there is, what can be done about it, or what needs to be done about it.